Hello and welcome back to another SRS podcast. I'm the host today, Jeff Mullin. Today we have two special guests joining us from Europe to discuss a fascinating partnership between the SRS and EUROSPINE about a course lecture that's being offered at the upcoming IMAST meeting. So before we talk about the details of that partnership and the actual meeting, maybe guys can you introduce yourselves?
Yeah, sure. So I'm Ahmet Alanay. I'm the past president of European Spine Society, EUROSPINE, and also I'm an active member of SRS. So I do both adult and pediatric deformity surgery, which is my main expertise. But I also do some adult degen stuff as well.
No man, where do you practice?
I practice in Istanbul, in Acıbadem Comprehensive Spine Center in Turkey.
Very good. Christoph?
Hello, Jeff. First of all, thank you for the invitation. It's great to be here. So I'm practicing in Munich. I'm a spine surgeon. My main area is that of degenerative lumbar. I focus on a lot of minimally invasive techniques, starting many years ago, 15, 20 years ago. And one of my main areas and interests and hobbies actually is that of full endoscopic spine surgery. And that's what we're going to talk about also at the upcoming SRS meeting.
Good. Before we go about the endoscopic discussion here, can you maybe tell us a little bit more about the EUROSPINE and the partnership with SRS and how this joint collaboration for IMAST came together?
Yeah, sure. So many of the EUROSPINE members are also SRS members. And then many of EUROSPINE members who were active in the governance of EUROSPINE has also been active in the governance of SRS. So we have our president-elect, Ferran Pelize, for example, who was past president of EUROSPINE. And this is not the first time, actually. We have done a few courses together in the history. So there has always been a connection between the two groups, and especially for this IMAST, as IMAST is not only covering the deformity topics, but including all the aspects of spine surgery. We've thought that, EUROSPINE and SRS collaboration, bringing expertise from different areas will be a perfect match for this IMAST meeting. So this is the first trial in IMAST, which will start with a session. And we hope that, we can pursue this collaboration with bigger events in the future, hopefully.
That's great, Ahmet. And as you touched on, the IMAST meeting for SRS sake focuses a lot on the newer and emerging technologies and where the changes come to their field. And I think probably one of the areas that's the most burgeoning right now is endoscopic spine. I'm not sure how it is in Europe. In America, it's still in its infancy. So Christoph, maybe tell us a little bit more about your role in evolution in endoscopic spine and then what some of the participants can look forward to in the upcoming meeting.
Well, my personal background is microsurgery. So I can say that for the last 20 years, I've grown up with a microscope, and I see a lot of advantages of this technique, which is why this should be considered nowadays the gold standard. But it's been about 15 years ago when I had basically my first introduction into endoscopic spine surgery, and I thought, wow, this is really the next step. This is elegant, and this is really nice surgery. And for the same reasons that we've seen, the same advantages that we've seen from going from open to micro, my personal experience is that we will see a similar improvement when you further reduce invasiveness of these surgeries going from micro to endo. So that's my personal experience. So I started round about 15 years ago, and the way that it goes for the learning curve, you start with easy cases, and then you continue with your learning curve, and you start doing more complex cases, and maybe also cervical cases endoscopically, and maybe also over the top decompression. So that's my personal background, and that's what we are also going to talk about at the upcoming meeting.
Can you tell us a little bit more about the meeting itself, sort of what other topics will be covered and sort of debates and controversies, or is it going to be more of a technique?
I think we've got a really nice symposium together, and I really hope that lots of people will come and join us to listen to our lectures, and also for a debate and ask interesting questions afterwards, so that we can discuss this technique, and hopefully everybody will learn from this. So I think we'll give first of all, we start with an overview over the topic. so that everybody knows what we're really talking about when we're talking about endoscopic surgery, because they're, with nomenclature, is it uniportal, is it biportal, is it, this. So we'll first of all talk about what can we do and where does this technique stand. So that's an introductory talk. Then the second talk is we will get a literature review, a literature overview, which I think is also very good for everybody who's going to join. Then there's a hot topic, which is a pros cons debate. So pro endoscopy versus pro traditional open or micro. So we'll hear a little bit more about that and the pros and cons, maybe what that people might have on this whole topic. Then there is another big field evolving also. This is that of biportal endoscopic surgery. So we will talk about that too, and maybe also bring up some pros, but also some controversial aspects, so that people are aware of this. And last but not least, it's a huge field, especially in Asia, Southeast Asia, is that of endoscopic fusion. And I think, with the fusion, this is where a lot of participants of this symposium will also have their interests. So what can we do? What can we do endoscopically? Where does it stand? What are the risks and what are the fusion rates? So that's basically, in a nutshell, what we'll talk about at the symposium.
I think this is also important because we know that IMS is usually participated by deformity surgeons, both pediatric and adult deformity surgeons. And we see more and more adult deformity surgeons, including me as well, in the IMS meeting. So from a deformity surgeon perspective, and as a person who has no experience up to now with endoscopic surgery, actually, I really wonder where does endoscopic surgery fit in the deformity surgeries? Because in the recent years, I see that, especially for the adult deformity surgeries, I see, the use of endoscopic surgery has started a little bit. And one of the interesting topic is this endoscopic fusion surgery. So how the factors like safety, long-term outcomes, and the learning curve influence the adoption of these techniques, in deformity surgery. So I think this will also enlighten a lot the deformity surgeons about, where we can fit this endoscopic surgery into our practices.
Yeah, that's great. And I'm not sure what the future holds for endoscopic, but I'm certain that the future for this meeting is going to be a great meeting. We're running out of time here. Could you guys give one last plug for any listeners that want to attend this meeting? Do you know what exactly date and time it will be at the upcoming IMAST?
So everyone, I think we'll have some really good points that we can talk about, some really hot topics as we outlined them just now. So we sincerely hope to welcome you on April 3rd, starting at 13:30 until 1500, and see you soon.
Fantastic. Well, that's going to be Thursday of IMAST. So looking forward to seeing everybody in Scotland, and it's going to be one of the many great educational opportunities at that meeting. Thanks, guys, for joining us today.
Thank you so much,
Thank
Jeff.
you.
Thank you, Christoph.
Thank you.
Bye-bye, and see you in IMAST.
Bye, guys.